Oh, she's had to leave.
Yeah, I had some chest pain today.
I see that. I see that. And you had to go.
Yeah, they
CAT
did
scan.
tell me. Yeah, they told me that to report me tomorrow. So I guess maybe you and Dr. Nanda, or you or Dr. Nanda, will be there to decide whether. Yes, I have lots of little tumors in my head, and the one that is causing the swelling is a little close to my higher functions. So I guess there's some options with doing like a blanket radiation or an excising, what is it they call it, the hot knife or whatever, the gamma knife.
Oh yeah, you can call it hot knife. You can call it hot knife. It's the same concept. It's the same idea. You can call it.
Okay. Do that one, but again, that's a little sketchy because it is close to my higher function.
Yeah. Yeah.
So, yeah. So I got that, and I'm stage 4 because it's migrated, and it is breast cancer. It's my HER2 positive. So I could have made a difference that I stopped the Femara last year, but honestly, I couldn't get up for work when I stopped it. I could not get up. I could not think.
And I'll tell you, Rita, before you start to beat yourself up, hindsight is always 20/20. I don't think any of us knows that for sure. Of course, the reason why we give treatment is to reduce the chances of something like this. But nothing we do ever eliminates the chances. And I'll tell you, if you ask all of your oncologists, every single one of us have given patients everything that we recommended, and cancer still came back. So I don't know that. Maybe not.
Well, and Dr. Nanda, she said, okay, well, I would like you to do like 12 things of chemo, and then she talked about radiation, and I said no to those things.
Sure.
But I did, when it was time to do mastectomy, I said you need to take everything, and I'm not going to do reconstruction, because you have to leave breast tissue, which is going to take all that. So I think I kind of balanced it out.
Yeah, and like I said, I think hindsight is 20/20.
Who would travel 2 feet, or whatever, to go to my brain, which is fine. But yeah.
I think the biggest thing though is that, we know, and I had a chance to look at the pictures from your scan myself. We know that there are multiple spots. I don't know if they're going to be able to do gamma knife. I think we're going to have to get an opinion from a radiation. That's an option. Definitely, that's an option. Every time you have multiple spots like that, and I do believe that, we have to weigh the risks of treatment against the benefits. You're already having symptoms from the cancer as it is now, and I think the biggest question here is, if we zap that area, yes, maybe there's a possibility. I couldn't tell you what percentage to your higher functions, but at the same time, we also know that not treating it, those higher functions are going to continue to deteriorate. So I think that's really what we have to balance, and then of course I know that Dr. Bankston had reached out to me yesterday, her and I exchanged messages, so definitely talk to her and get her opinion. But I think
she really likes you. She texted me that, but I couldn't really text back.
Yeah, but let's get more information. Let's know what your options are, and then you can make a decision for yourself. The presumption is that this is breast cancer. Again, we don't know. The only way to tell for sure is to go in and remove a sample. I don't know that that's something we need at this point.
A biopsy, yeah.
I don't think.
Because I think you could probably tell from the scans, because I remember what my scans looked like when I had and I actually colorized. I colorized them and did them in different things. So I have like 6 pictures of my cancer that are in different,
She made art,
I made art
with her cancer cell pictures.
You could see how it was just going, it's like that, So I know what it probably looks like in my head.
Sure.
Yeah.
So I'll let you think about that. I know yesterday when we spoke, you were very hesitant as far as whether you wanted to do treatment or not. But I think it's something you should consider, because to me here, what I worry the most is that not doing treatment impacts your quality of life. This is going to increase your risk for seizures. It's going to cause a lot of cognitive and functional impairment for you. And maybe treatment would help some of that. So I think
of that, yes. I get that. Just like talking yesterday about what happens if my heart stops, that kind of stuff.
Absolutely.
You have to talk about all of those.
Absolutely. Those are very important.
Yeah.
And I also agree with them that this is this is stage 4, you know, which of course puts everything in perspective. But if you're HER2 positive, you know, we have a lot of options now. I think this is something that you need to come back with Dr. Nanda and just have a discussion about where do we go from here. Because even since your last treatment, as you know, oncology is something that keeps evolving in terms of treatment options. And even since you last spoke with Dr. Nanda, there has been a number of 2, maybe even 3, if I remember off the top of my head now, new treatments that have been approved. So definitely I have to go back and look to see about your HER2 status. But my gut feeling is that if you're HER2 positive, she has some options to offer you if you're interested in treatment. Sometimes if you have what we call a dominant lesion, which I believe you have here, that's what's causing the bulk of the swelling, we may want to go in and remove that dominant lesion, you know. But again, if we give you steroids for a few days and some of that swelling retracts, it's possible that you may not need surgery, because again, what you have is more than a surgical disease. The only reason to do surgery here is because the tumor has put so much pressure on your brain tissue that you have tissues crossing the midline, and that's a concern.
That sounds concerning. Yeah.
So that's going to be the big issue. But I will put in a consult for a radiation specialist to come talk to you tomorrow, just to have that balanced perspective. I probably would not be part of that meeting tomorrow, the tumor board. Yeah, but it's possible that once they have the meeting, they will report back to Dr. Nanda. I have to cover 4 hospitals, and I also have clinics, so I probably couldn't make it to that. But they will report back to Dr. Nanda.
Cancel an appointment with you guys tomorrow, because that was my regular appointment.
Oh, is that right?
I was supposed to get a blood work and all that. Every 3 months.
Well, I should just send her a note then.
Yeah, well, it probably, well, I did it through
My chart.
my chart, so,
Okay.
and I checked the hospitalized thing.
Good.
So hopefully somebody
It
gets
gets
it.
it gets to
It
us.
loops around. That's the beauty of my chart. Yeah.
All right, very good. Did you have any questions for me?
No, I think you've explained everything really, really well, and so did
The neurosurgeon, Jason?
the nurse. Yes.
Dr. Shigeri? Dr.
Yeah,
Shigeri?
Shviri, yes.
Okay, good. We'll swing by to see you again in the morning if there are any new updates. Otherwise, we may just follow from a distance and see what the hospital is doing. But definitely we'll get the radiation oncologist on board. All righty?
Okay.
Thank you.
Good luck.